Benefits. Well, I have seen a lot of good changes here. Well, for one, just in my clinic, it makes my work a lot easier. I can get through the patients faster. My records are more accurate. I don't miss stuff out of my records because I got the as you type, so everything gets included into the record that should be included. Out there in the main clinic, the main thing that I've seen is people are being seen a lot quicker. The other thing I like is, I don't know, it seems like the medics are getting more, I guess, hands-on time with the patients than what...
More engaged?
Yeah, they're more engaged with the patients than what they were before. So I think that's a good thing.
Would you share this process at your next assignment?
Oh, definitely. I plan on it. Yeah.
Okay.
Team-based documentation, I think it provides a quicker, faster way to actually document all the correct information about the patient. It kind of builds some unity, which I don't think we really had here before. It kind of forces communication where before you couldn't really do that. Now you have to, you don't have a choice. So for those people who don't want to kind of comply with everything, now they have to. I think I'm transitioning in between patients a lot better. It's going a lot quicker. I think we're getting more information in a faster period of time, something more accurate, where before it's just like, okay, we got heard, we go, 20 minutes, let's go. Now it's like there's a connection between the medic or the nurse and their provider, and then each provider kind of has their own standard. Everybody's kind of trying to meet that. It's kind of bumping up our knowledge, especially as medics. I think we're learning a lot more.
Efficiency from the provider standpoint, certainly. Everybody's sort of doing. I mean, the doctor ought to do only the things that only the doctor can do. So if there's other things that can be done by a nurse or a medic or a tech, I mean that's utilizing your personnel the best way possible. I have to say, but I surprisingly found you guys to be very knowledgeable about your various areas of expertise. I think it's going to make me more productive with the application of the templates. I've learned how to use the Dragon better, learned how to correct that better. I think in terms of process improvement, having the medic, working directly with the tech and being able to train them, while that's not specific to MAPS, it's it's something that came about through this process that I think is going to help. Having the formulary for my commonly prescribed medicines is going to improve my efficiency and get more information to the patients that's applicable to what reinforces what I'm telling them. So there's been several things will definitely change in the way I practice as a result of this. Absolutely, yeah. No, I think that would if I'm have another assignment in the DoD, I really feel like I could be probably the go-to guy for troubleshooting or just championing using some of these tools that they may not know are available. Yeah.
It improves efficiency and makes things go much quicker. I think less things get missed. I think it's really helped. I think it's helped to reshape our clinic into something that works better. Definitely, we can see more patients. We can document better, and makes at least the lives of the providers a little bit easier too. Well, me, I think I got a little bit better knowledge of Dragon, AZType, some of the other programs that we were given. I got a little bit more electronic equipment. I think one of the big things was pairing us together with one of the medics or nurses, and giving them a lot of tools to help us, and so those are the big things.
Some of the benefits? Well, I feel so far that the medics and the nursing assistants are more aware of the right coding and where to go to document, so that it helps out the providers, so they don't have to do as much and like search as much to like find like the right coding for certain procedures. I know it's helped a lot of the doctors too, because they were confused on like quite a few things, and it actually helped to clarify the way that we used to chart, because we thought we were coding the right way and charting the right stuff, and it turned out that we weren't. So it did help us in a big way with that.
I'd have to say it's probably about 120% improvement on that. Before we started this, it was more individualized. We weren't doing the proper documentation. Everybody was kind of like on a different page. And since the MAPS 2.0, we're all on the same page. We're covering down for each other. We're making sure we're all, doing what we need to be doing as far as documentation. And it's improved about 120%. Oh, it's helped me tremendously. It's alleviated some, many of my problems. Having to track down. Why wasn't this done? Why wasn't that done? I know exactly if I need to find some information on a patient or anything we've done, it's easy to find, to track, because I know exactly how to get to it, and I know that my soldiers and also the civilian staff, they got it. They properly, documented it, so it's helped a lot. Morale's definitely improved. I mean, because no matter where you work, when you're kind of confused, on how to do your job, and daily you're being told, oh, you're not doing this, you're not doing that, and we didn't really have the training. When you can come in, you're confident about your job, you're going to do it, you're going to do it right, and if you falter, there's someone there to show you right then and there what needs to be improved on, and morale's boosted completely.